Hello, welcome. Welcome to our psychiatric mental health nurse practitioner virtual open house. My name is Ashley Chilla. I'm the Associate Director of Admission, and I'm going to let my colleagues introduce themselves as well. You can
Yeah,
go first,
hi.
Michael.
So hello, my name is Michael Walker, Director of Admissions here, and I handle our post-licensure programs. So I'm tongue-tied this morning. It's a pleasure to meet everyone, and I'll pass it over to Dr. Holder.
Hi, I'm Kristen Holder. I'm the Psychiatric Mental Health Specialty Director. I'm an FNP as well as a psychiatric mental health nurse practitioner. And I also have my doctorate in public health. So a couple different perspectives in this role. And I'm super excited to talk to you guys today about our PMHMP program.
Yep. And so how this is going to work is we are recording this session, so it will be available on the School of Nursing's YouTube page as well as in an email that would be sent out to all registrants. And Dr. Holder is going to give a great presentation about the program, and then we'll open it up for questions afterwards. So if you have anything that was not answered during the program overview, we can chat about it then. And then we'll also give some information about how to contact us in the admissions office if you need anything from us. So with that, I'm going to hand it over to Dr. Holder.
Okay, thanks so much. I'm going to share some slides that everybody can see. And can everybody see that? Oh, it disappeared. Just one second. Okay. So yes, just talking today a little bit about our psychiatric mental health nurse practitioner program here at Emory University. So obviously, if you are in this talk, you're probably aware of the great need for psychiatric mental health nurse practitioners in the United States. But I just kind of want to reiterate some of the current demands for psychiatric mental health nurse practitioners and behavioral health providers in the United States right now. HRSA has said that there are over 123 million residents living in areas with a shortage of mental health professionals. There is currently over fit. Oh my gosh, did it do it again? Sorry. Why
Oh
is
no,
it?
you're fine. We could see it.
You can? It
hmm
says it's paused for me. Hmm.
So currently, we see the need slide.
Yeah, it's not showing for me. Sorry. I don't know what I'm doing wrong. Let me stop the share and start over. Okay. I was trying to minimize something and it, anyway, there have been over 38,000 job openings in this early part of the year, and particularly in Georgia. And if you're interested in staying in Georgia or in the South, we are ranking 48 out of 51 in terms of access to mental health care. So great need here in Georgia and in the Southeast, in addition to nationwide. Just thinking about the role of Emory in this, in US News and World Reports, Emory is #1 MSN program, #8 DMP program, #2 BSN program. Very strong reputation in the nursing and nurse practitioner world. And this program is focused mainly on care management across the entire lifespan, and that includes both psychotherapy and medication management. And I like to emphasize that our curriculum has more classes in therapy than a lot of the other PMHMP programs. And I think that can be a unique distinction because I think it's particularly helpful that psychiatric nurse practitioners can both prescribe and provide psychotherapy. So, what do we offer here for plans of study? We do not offer an MSN, and that is largely because most of the news that's been coming out of national certifying bodies is that they are aiming to move towards largely doctorate of nursing practice programs in the future. So we do offer the DNP, and then for people that are already nurse practitioners in other specialty areas, we offer the postgraduate certificate. The postgraduate certificate, both of them are hybrid programs, but the majority of your coursework will take place remotely, with some synchronous and largely a lot of asynchronous work. But there will be the community feel of getting to know your classmates in person, as there are 2-day in-person intensives each semester. In the postgraduate certificate, it's a minimum of 3 semesters based on a custom gap analysis of previous work. And there are a total of 720 clinical hours with 45 hours of on-site and virtual simulations. Clinical hours begin the very first semester in the postgraduate certificate, whereas in the doctorate of nursing practice, the clinical hours begin in year 2 after you've completed a number of your core prerequisites and had some of your therapeutic content. The doctorate of nursing practice has over 90 hours of simulation and a total of 1,080 hours of clinical experience. This is the plan of study, and this is also available on our website. I can also send out a link to anyone that contacts me in terms of the plan of study for the post-BSN or post-MN DNP. This is the full-time plan of study. You are also able to do this as part-time, or we have definitely had students start full-time and then scale back to part-time at some point in their studies. So starting semester 1, you're right off the bat starting to get some work in the PMH&P program, and then you're going to take pathophysiology and pharmacology with all of our doctoral students together. And then you're going to, every semester you're getting some of your core content as well as some of your content that is specific to psychiatric mental health. Then starting a semester 4 in the fall is when those clinical hours begin, and kind of starting off a little bit slower the first semester with 180 hours, and then each subsequent semester you will complete more clinical hours. This is the rest of the curriculum for the DNP, so it's a total of 7 semesters. Honestly, not much longer than an MSN, and you have a terminal degree. And another thing that I think is novel about our program, in addition to the fact that there are more courses in therapy than a lot of others, is that we also have courses specific to health and substance use disorder and novel psychotherapeutics, advanced psychopharmacology. The postgraduate certificate is 3 semesters. And again, it's taking the core didactic courses with the core clinical courses. So a little bit about who teaches in our program. This is me. I'm the program director. I have a small outside private practice called Balance Health and Psychiatry, where I provide therapy and medication management largely to patients that have a history or current diagnosis of disordered eating, eating disorders, depression, or anxiety. I also have a lot of expertise in public health and social behavior. I have a master's and doctorate in public health, as well as my master's and bachelor's in nursing. And I have previous experience in inpatient, partial hospitalization, and outpatient behavioral health settings. JoEllen Schimmels is full-time faculty in our program. She has a small practice, Spring Health, and she has particular expertise in trauma, trauma-informed care, PTSD, anxiety, military, veterans, injuries, nurse suicide, and a lot of work in nursing curriculum development. Aparna Kumar has a joint appointment with the Carter Center, and she has experience across the lifespan in a variety of different settings and a particular expertise in child, adolescent, and perinatal mental health. Then Kayla Mays is a part-time faculty for us because she works at Children's Hospital of Atlanta. She has been a vital bridge for us with children's healthcare. She is the head of all APPs in behavioral health at Children's Healthcare. So she's been really helpful in terms of connecting us with the child and adolescent psychiatry field at CHOA, expanding our preceptorship experiences there, as well as just really having a lot of hands-on experience and also being a good resource for future job placements at CHOA. Her areas of expertise include child and adolescent psychiatry, substance use disorder, suicide prevention, somatic disorders, and trauma. So I like to highlight all the different core faculty members because I think we all have varied areas of expertise, and I think it really rounds out the kind of experiences or mentors that you can have depending on what your clinical interest might be. Then some programs rely on you to find all of your own clinical placements. One advantage of Emory University is that we have a dedicated clinical placement coordinator. Lakeisha Jackson helps coordinate our clinical placements. She handles all of the credentialing and letting you know what you need to do. We meet weekly with her in terms of trying to find the best match for students in terms of their interests and what preceptors we have available. Placements occur across the lifespan. They differ each semester. And placements can be with other psychiatric nurse practitioners, psychiatrists, licensed therapists, social workers, psychologists, or marriage and family therapists. Just to give a few examples of some of the local clinical experiences that we have offered in recent semesters, we have offered rotations in inpatient child and adult psychiatry at Grady, Emory Midtown, Ridgeview, Skyland Trail. We've offered rotations in emergency psychiatry, outpatient psychiatry clinics and practices, outpatient therapist offices and practices. And we've also offered some specialty rotations. Addictions, we have had some opportunities with Addiction Alliance, Emory, and Chris 180. We allow telehealth rotations only up to 50% of maximum hours. We have increased that from 10% just due to the large numbers of patients that are now seen on telehealth and wanting to accommodate the fact that some rotations you will be doing a mix of in-person and telehealth, and also to prepare you for being able to work in that environment if you do need or want to intermittently see patients via telehealth in your professional career. We also have specialty rotations with Marcus Autism Center and Emory Autism. Consult liaison, where you would rotate on hospital floors doing psych consults on medically admitted patients. We also have had a rotation doing psych evaluations on organ transplant recipients and some with treatment-resistant depression receiving TMS and ketamine. I get a lot of questions about, working with the number of clinical hours that need to be completed. And I would say we discourage working full-time if you're a full-time DNP student at the time of your clinical rotations. But again, clinical rotations do not begin until the second year. I will say we have had students work full-time. We just don't advise it. So how do you apply? To begin the program, you must have a baccalaureate degree from an accredited nursing program and a nursing license in the state of Georgia or the compact multi-state license. An application fee, transcripts, resume, personal statements, and then 2 to 3 references, preferably one to be a nursing supervisor or some sort of professional colleague or supervisor or faculty member who can really speak to your professionalism and experience. Oops, I put professional statement on here twice. There's only one. And then experience, paid or volunteer, in behavioral health, mental health, or as a nurse is strongly recommended, but it's not required. And I'm going to explain a little bit more what I mean by that on the next slide. And in terms of applications, if you were a current Emory MN student or recent Emory MN graduate, some of these application requirements are, eliminated because we will already have copies of your transcripts. Your application fee is waived. and we have your references. We do require an updated application and an updated CV or resume that includes your current GPA. You are welcome to submit a new personal statement if you feel that it is going to give more insight into your interest in behavioral health and your experience in it if you don't clearly have a year of work experience in behavioral health. You're welcome to submit an updated reference, but those are not required. So previous experience, competitive applicants will have direct patient care experience of 1 year of full-time employment in psychiatric mental health, behavioral health, or an equivalent setting. However, if you'd like to proceed with applying without a year of nursing or behavioral health experience, just keep in mind that your application, your statement, and your recommendations they refer to some of the relevant experience. Like, did you already have a previous degree in psychology? Have you already had a previous, minor in neuroscience? Have you had extensive volunteer experience on behavioral health units? Do you have applicable work experience? We have students that were MN students that have not worked as psychiatric nurses, and but they were behavioral health techs for years, or they were an LPC before, or they had a previous degree in psychology and have taken a mental health first aid class and really been able to demonstrate in the personal statement that this is the field they want to be in. We're really just wanting to make sure that this is a great fit, that we are a great fit for you, and that you're going to succeed in this program. And that you really have an understanding of what behavioral health is and that you feel comfortable in the setting and community. And because it's a little bit different than some of the other specialties. But again, I'm happy to, if anyone has questions about that, I'm happy to meet with anyone before they apply. If they want to ask questions about whether they feel like their experience is competitive or if they want suggestions for other ways to get additional experience before they start. Again, with DNP, a lot of times if people don't have psychiatric nursing experience, they may start working as a psychiatric nurse when they begin the program, and then they still have a year's experience before they enter clinical rotations. Then I'm going to open it up for questions. And I also want you guys to take note of my email if you want to directly contact me with questions, kristen.holder@emory.edu. And December 1st is the next deadline. I strongly encourage you to submit by the next deadline, but that doesn't mean that that will be the only deadline. We are potentially working on one more deadline to roll out after this. So I'll open it up to questions and then see if Michael and Ashley want to add anything.
I do have a question.
Yes.
My name is Gia. I'm actually a student at Emory. I'm currently doing my BSN and I graduate in May. And so I was just kind of interested to see. I've been kind of debating between the emergency room and either like a psych mental facility as far as my relevant experience. What would you say is better as far as like what you guys look for in applicants in that aspect?
You know, I would, my knee-jerk response would be to go work in psychiatric nursing. However, I'm gonna give a caveat to that. If you think that you might have interest in potentially doing consult liaison work or doing psychiatric emergency services, then I think the ER is also a great fit. The bulk of emergency health crises, particularly in terms of attempted suicides and some psychotic breaks and some substance use overdose, do present to the emergency room. So I think you would still definitely get a lot of great experience in the ER. I think it's more kind of like what is going to help shape your professional interests more. So psychiatric nursing, you're going to get a lot more exposure to some of the therapeutic communication and some of the psychopharmacology and some of the long-term care planning and interdisciplinary teamwork. But the ER, you're going to get a lot of exposure to crisis management, and you kind of get a feel for that med psych universe. So I think both are applicable. I would just think more about what avenue you want to go down, and then you could speak to that in your essay as well.
Okay, thank you so much. And then I did have another question, if that's okay.
Of course.
I just was wondering, on average, how many people are in each cohort for the second MP program?
Um, so it's a newer program. This is
Okay.
only the third year, and
Okay.
I would say right now our cohorts are between 13 to 20 people.
Okay. Okay. Thank you.
Mhm. Any other questions? Those were good questions.
Hi. Sorry, my camera's off. I'm currently in the car on the way back from a doctor's appointment. But my name's Leah Pebrocki, and I'm currently enrolled in the MN program at Emory.
Mhm.
And I was just wondering if you guys still offered like full time versus part time, or is that an outdated thing on your website?
Full-time versus part-time for DNP?
Yes.
Oh, yes, yes. We offer both. Does it say only one or the other?
Um, they're like two different places. One says just one and one says just the other. So I was just kind of double checking if that was a
Okay.
possibility because I would be interested in working full time as an RN, I think, during that program.
Yes. So we offer both. My recommendation though is if you think there's any chance you want to try it full time, is I would apply at full time, and then you could always scale down to part time. What is hard to do is if you're part time and you're like, oh, actually, I want to scale back up to full time, the way the courses and when they're offered, we can't do that. So, but you could start, I mean, we do have people that start full time and are still working during the didactic portion, and then they scale back to part time, if that makes sense. Or you could just start.
Okay. Oh, sorry. Thank you so much. That's very helpful.
Yeah.
I did have another question. What do you look for? I know like, you have to have the experience, but as far as like personality or other attributes that weren't discussed in this meeting, what do you look for in your applicants?
Well, I'll let Michael and Ashley speak to this too, because they read applications before they even get to me. But um, I know for me, I'm really looking for someone that is wanting to, I guess, kind of humanistic. Like you care about the person, that it's very person-centered care, and that you obviously have been a strong student. I mean, you guys are already at Emory, so I know that you already are used to like a really strong, challenging curriculum. But we're going to look at the strength of the curriculum and how well you've done. Want to make sure that you're going to feel comfortable in advanced patho and advanced farm. But I think even more importantly, you this interest in person-centered care, feeling like you want to work as part of a team, because even if you're an individual in outpatient private practice by yourself, you're still going to need to coordinate with other team members and be comfortable with that. Um, and really just a demonstrated interest in behavioral health. And whether that is through work experience, whether it's through previous learning experiences, that this is something you really want to do. And I hope that answers it, but just a sense of really caring and person-centered care in addition to being able to handle the academic rigor.
Yes, that answers my question. Thank you so much.
Mhm. Michael and Ashley, do you have anything to add in terms of what you're looking for in terms of applicants?
You actually summed that up beautifully. So nothing to add in terms of what we're looking for candidates.
Okay.
Yeah, I think oftentimes people ask like, what's the minimum GPA? there is no minimum GPA for these programs. Obviously, you want to make sure that you can handle the curriculum and it is rigorous. So we usually see competitive applicants with at least a 3.0 or above for their cumulative GPA. But there are no hard outs basically when it comes to GPAs.
Thank you.
Thank you so much.
Absolutely. Any other questions from you guys?
I have one. It's not necessarily for me, but this is a question that I think we get often. And I'm wondering if you can speak on um, the private practice versus working in a different healthcare setting. We think we get a lot of students who are interested in opening their own practice for this particular specialty. And sort of what you think sort of the differences are between that, if there are personality differences with people who want to open one or go work in another, just a little bit to that particular part of it.
I think a lot of times people that want to work in private practice, they might have kind of an entrepreneurial type sense about themselves. And but you don't necessarily have to have that. I've also seen people that said, I just feel like I've always been somebody that wanted to work as part of a team. I wasn't necessarily entrepreneurial. I didn't necessarily want to like lead a team. But then I worked in inpatient or partial hospitalization for 10 years, and I just had a different way I wanted to do things, or I was ready to do it on my own, or I really felt like the lack of access to care was more on the outpatient level. And I wanted to help be a part of expanding that access to care. So I'm going to do a sliding scale outpatient clinic. And then I see people who are like, I want to go straight into outpatient after, 1 year of experience in a more of a group setting. And I have all these ideas to actually build this business of outpatient clinics. And there's no right or wrong answer to that, but I do feel like there's like two different types of people that want to go into outpatient work. I do think it's helpful to have experience in one of these inpatient or partial hospitalization or a group practice before you go out completely alone, because there's so much to be gained from talking with your colleagues and learning from them. But there are ways of doing that on your own through being in supervision groups and having certain people you collaborate with and have set meetings with. And so you have the opportunity in this program to have rotations in both that can help you get additional knowledge on that. I've done both. And so there are pros and cons to everything.
Great, thank you. Well, great. If there are no other questions, like I mentioned, this is being recorded and it will be posted on the School of Nursing's YouTube page as well as sent out to registrants after this. Kristen's email is up there. Our email at the admissions office is nursingquestions@emory.edu. If you have any questions about the admission process, we're more than happy to help you out. All right. Thank you again for joining us, and we can't wait to see you all as applicants soon.
Thank you so much.
Thank
Thank
you.
you.